So if you're watching this video, it means that you're interested in being a volunteer at Healing Steps. We're so grateful for you. So we're just gonna go over a few basics, things to expect both as a sidewalker and as a horse handler. Both are volunteer positions at this time. Sidewalkers, your job is the kiddo. So I have right here a gait belt. All kiddos, every single time will be wearing a gait belt around their waist. For the ones that need support staying on the horse, you're gonna have your hands in the gait belt. Even some of the ones that we can trust more physically, or we love the rooster, physically, or sometimes friends like to think about jumping down, for fun. But for those friends, you're gonna put your hands in the gait belt at all times, and me or your therapist will prep you about that if that's one of the kiddos that needs that to be done. So it'll be around their waist, your hand will be in, they will be up on the horse, so your hand will be in like this. Some friends feel more comfortable with their hand in the gait belt, and we ask them, do you prefer my hand in your gait belt, or do you want my hand on your knee? As a sidewalker, I want your hand on the child or young adult at all times. So whether it's in the gait belt or on a leg, that way you can really feel and be close if something were to happen. Now, obviously all these horses are well trained. They know their job. We've got some itchies. But horses are animals and they're gonna do what they're gonna do. And so your job as a sidewalker is 100% safety of the person on the horse. So your job is kind of be looking for things that can scare the horse and be aware so that you're ready for something were to happen, to do an emergency dismount or help maintain the child or individual on the horse in case something were to happen. So what that looks like is hand in the gait belt, hand on the leg. Sometimes me or the therapist will need your hands for extra supportive activities. So if that means you're resting here and you're holding the game board here or handing the balls here, that's great. Your therapist will instruct you. Every once in a while, I'll need two hands from one of the sidewalkers and the other one will stay hands-on. It'll just completely depend on the situation, and your therapist will guide you through that. If you are a horse handler, your job is purely the horse. I don't want you doing gaits. I don't want you worrying about the child. I don't want you doing anything else other than watching the horse. At any point, if the horse looks nervous or stressed or doesn't like something we're doing, I completely expect you to let your therapist know, but in a way that's appropriate, that's not gonna scare the parents. So for example, we're throwing balls and Bella here is acting nervous, like saying, hey, Miss Kelsey, Bella's looking like she's not loving the balls today. And that's gonna give me that cue just in case I can't fully pay attention to the horse and my kiddo and everything else that's going on. So your job is the horse and 100%. The problem is if you're not 100% attentive to the horse, it's nobody else's job to be. And so we just don't know what'll happen if only one person has 50% attention on the horse. As the sidewalker, your job is 100% on the patient, okay? So noticing if they're starting to tip. Oh, hey, Miss so-and-so that's on the horse, I think your body's tipping over here. Let's push you up a little bit. Again, we have families that are a little bit nervous around the horses. They're not familiar. And so everything we do is with confidence and patience. And we want to give the parents that confidence too. If we start to act nervous, like, oh my gosh, you're tipping or you're leaning, all of a sudden the families lose a little bit of confidence as well. And so we just really want to make sure we maintain, our professionalism and give the families and the patients that confidence. Another thing to briefly go over is dress code. All volunteers can have and will have a t-shirt. I have those, so make sure to ask for them. I don't ask that you wear them every time, but it's an option if you'd like to. As you see, it's a hot day today, so I'm in shorts, long shorts. Oh, Bella's gonna cover me up. Long shorts, totally okay. Nothing shorter than this, please. We have to maintain our professionalism. You're welcome to wear jeans and boots. You're welcome to wear nice jogger sweatpants, but remember, even though we're in a barn, it is a medical facility, so we want to represent ourselves well. Let's see. I think that covers most of the tidbits. Please make sure you read our volunteer letter that is going to be probably attached with this link. Make sure that you read through the volunteer handbook and then ask if you have any questions at all. Before every session, you're going to be debriefed on the expectation with the kiddo or with the young adult. As far as tendencies, is it a kiddo that likes to lean over and doesn't notice when they're leaning, or is it one that maybe has behaviors and we need to make sure that their foot isn't hitting the horse's side, asking them to go faster, things like that. That's your therapist's role. They'll give you that. But if you have questions, always ask. And remember, the most important thing is we're here to have fun and support whoever's on the horse. And so please do that and enjoy yourself and have a good time. So we look forward to having you volunteer with us, and again, are really grateful for your time.